Spondylolisthesis basically means that one bone, one vertebrae has shifted forward on another. And it can happen in lots of different ways, but the most common ways are degenerative, which can happen from arthritis, and the second most common way happens in a younger athletic population that does repetitive hyperextension. So I see lots of high school students and lots of young athletes who basically have a stress fracture in their back, and that stress fracture has allowed for one bone to start shifting forward than another. The symptoms in a younger person usually presents with back pain, and that's usually a back pain that's worse with hyperextension or leaning backwards, and it's usually someone who's very athletically involved, typically a multi-athlete, a multi-sport athlete. In a person in their 40s or 50s or older, it can present as pinching of the nerves. So as the bone shifts forwards, it can cause stenosis or tightening of your canal, and it can start pushing on the nerves. And most of those patients present with pain radiating down the leg, with numbness or tingling, or cramping in the legs after they walk a certain distance. We can try to stabilize your core with physical therapy to see if we can calm it down, to anti-inflammatories to see if we can calm down the nerves, to possibly cortisone shots if need be. In rare instances, it may be that they need surgery if it's progressive, if the bone is shifting more and more forwards, or the nerve is not responding to the conservative care that we're taking. If you're a younger athlete and you present with back pain, especially with leaning backwards, you should see a primary care physician, because we can either take you out of sports, slow down the activities, or put you in a brace to try to get it to heal before it gets too bad. If it's more of an arthritic or a degenerative problem in an older person, then yes, we can calm that down with physical therapy, anti-inflammatories, but if you're not getting better after 4 to 6 weeks of that, then you should seek an orthopedic care to see if there's anything else that can be done to alleviate the symptoms. The treatment options typically involve a surgery where we take the pressure off the nerves, and we have to stabilize it with screws and rods and a fusion operation. However, more and more minimally invasive options are available where we can do this operation in a minimally disruptive fashion, where we can either take the pressure off the nerve or stabilize in a percutaneous fashion. Usually after surgery, most people's leg pain is gone. They can walk longer distances, their activity level is significantly increased, and their quality of life is dramatically improved.